Dear students, I am Professor Hatem Elgamal. We will deal with the malposition and the malpresentation, and this is the second part of this lecture. At the end of this lecture, every one of you should be able to understand the mechanism of labor of face and how we can manage the face and the brow presentation together with the risks and the complications of the face and the brow. Face presentation, it is a malpresentation where the face is the presenting part and the denominator is the mentum or the chin. Etiology of the face, the incidence is about 1 in every 300 deliveries. The predisposing factors or the causes are the pendulous abdomen, flat pelvis, multiple pregnancy, prematurity, cases of the abnormality and congenital malformations like anencephaly and the fetal neck tumors, together with the spasm of the muscles of the back of the neck of the feet. In this figure showed the different positions in case of face. We have the anterior positions where the chin is directed anteriorly. We have the right anterior and the left anterior. The most common is the right chin anterior. And we have the posterior direction in which the chin is directed posteriorly. We have again the right posterior and the left posterior. We have different types of face. Primary face, it is present before labor. 15% of causes of face is fetal malformations like anencephaly. So if you diagnose a face, you should exclude congenital malformations like the anencephaly. We have the secondary face, which develops in labor. Positions in case of face, mento anterior in 60% and 40% mento posterior. The mechanism of labor, engaging diameter here is the submento-pragmatic diameter, which is 9.5 centimeter. Descent occurs till the pelvic floor is reached and the rotation occurs. Mento anterior, the mentum leads and rotates anteriorly with further descent and rotation till the mentum under the symphysis pubis, and delivery here occurs is by flexion of the head and not by extension. In case of mento posterior, the symphysis leads and rotates forward and the mentum is carried to the hollow of the sacrum. The head should extend to allow delivery to occur. At the same time, the shoulder enters the pelvis and no pelvis can accommodate a normal fetus because the sternopragmatic diameter is 18 centimeter. Face presentation, the management, diagnosis, in most cases the diagnosis is made in labor. Palpation longitudinal lie, the head is lower in position, a groove between the head and the back. By BV examination, the bony landmarks of the face are filled. Anterior fontanelle, frontal sutures, supraorbital ridge, nose, mouth, and the chin. Rupture of membrane may occur early and the chord prolapse may occur. What is tumification? Tumification of the face, it is the caput formation of the face. In face presentation, where the soft tissue covering the face are edematous and the bruising is the rule. If the chin rotates anteriorly, delivery may occur. But if the chin rotates posteriorly, cesarean section should be performed, as we explained that there is no mechanism of labor in case of the occipitoposterior. Brow presentation, the incidence is very rare. It accounts about 1 in every 2,000 deliveries. The etiology is exactly the same as the face. The mechanism of labor, there is no mechanism of labor actually. The engaging diameter is the mento-vertical diameter, which is 13.75. And the largest pelvic diameter is 12.5 centimeters, so there is no mechanism of labor. The head is partially extended, so the fetus presented by the brow, and the denominator is the frontal bone. Here the picture which explains the trial of engagement in case of brow, which is impossible to be engaged. Sometimes conversion to face or occipitoposterior can occur. Management, palpation, the head feels unduly large. By BV, early rupture membrane to occur and the brow is identified by the anterior fontanelle, the frontal suture, supraorbital ridge, the root of the nose. The chin cannot be palpated to differentiate it from the face. Brow presentation should be suspected when a Barrett's woman has unexpected dystocia, and the only way to deliver the brow is by cesarean section. Thank you.